Okay, just as I thought, you can use a local anesthetic, but we have to think about what that is. A topical, like kind of, when you get a Novocaine shot, and often the doctor puts like a topical numbing solution, that's how that would work. But the other way, and the more effective way to actually anesthetize the area, is to give injections. And that, that's one of those situations where numbing the area is more painful and time-consuming than just going ahead with the procedure. Kind of like if you ever had a mole removed or something, or, something quick and sort of easy. As like an adult, you can make that decision of like, well, I think I'll just I'll just deal with that instead of like having the pain of the injections to numb the area, so I don't feel the pain of like the procedure itself. So for a baby, obviously you're making that decision for them. So there's the topical anesthetic, which is just kind of like a cream that numbs just the surface. There's the injections, which give a more thorough numbing, but are painful to administer. And then I was reading like all sorts of like botched jobs and 2 babies dying because of the anesthetic, like having a reaction to it. Oh my gosh, botched jobs is that's another serious risk, that somebody does it wrong. They either take off too much skin or too little skin, or they do the procedure incorrectly. That causes a problem that sometimes isn't evident until the child is older. So with that in mind, it's like obviously you have less of a chance of any sort of an issue if you just leave the situation alone. There was something else I wanted to say about that, the hygiene issue. There's so many of the reasons why culturally Americans started to circumcise in the first place are just no longer valid. Hygiene for one of them. We're not living in a third world country where people take baths, it's the US. People take showers every day. Like the issue of, what I'm saying? It's like everybody's got running water, even if you live in a trailer home. So it's like the issue of the hygiene thing really doesn't hold up in a sort of modern society. And there were other reasons, like, people thought it was like prevented masturbation, sexual deviancy. There were other sort of like psychological unfounded implications that went around the circumcision issue as well. So, it's an important topic. It's one to really consider. I guess, as you can see, I'm not exactly on the fence about it. I really think that it's probably a positive thing that we're moving away from this trend of automatically circumcising babies in hospitals, and that, again, it's something to consider, to think about, plan ahead of time, and if, the parents can't be on the same page about it, then, well, welcome to parenting, because that's really, this won't be the first or the last issue for which you are going to have a conflict on how to handle. And so that, that's where you kind of have to figure out how to negotiate and, what battles you're going to fight together and what you're not going to fight about. Is that what I mean? I don't know what I mean. All right, let me check my time. I wanted to talk a little bit about miscarriage. I'm back. Yeah, I want to win. Yeah, I don't think I really have enough time to talk about miscarriage. I think it's sort of a big topic, and I just wanted to say a couple of things. One was that about how incredibly common it is to miscarry. They say like half of all pregnancies end in miscarriage, and many women are not even aware that they're miscarrying. If you didn't know you were pregnant to begin with, and you might just had like a later period, then it could even be like 2 days late kind of a thing, and or a heavier period than normal. There's when you're trying to get pregnant and you're doing pregnancy tests, like the second you can do one, they get like, you can do them earlier and earlier now. Now you can do them even, I think there's some that you can actually do before you even are expected to get your period. Anyway, so in a weird way, like we sort of know more about like what goes on in that realm, but you know, miscarriages occur all the time, and it's that doesn't make anybody feel any better about having them, or maybe slightly better. That it's like, you know, sometimes when a woman has a miscarriage and she starts talking about it with her friends, you know, you uncover all these stories, things that you never knew about, you know, close friends of yours who could have had, you know, multiple miscarriages before they ever got pregnant or what have you. I think the thing that gets me actually is more of the grieving process, because it's a loss that's like very sort of difficult for people to wrap their minds around. You know, for people, a lot of people on the outside, it's like, well, you know, look at the bright side. At least you got pregnant. Oh, well, you can try again, or you can, you know, you can have another. There's always that sense of like diminishing it, and I think that's I think it's very painful for a lot of women who, you know, it's still their pregnancy. It was still wrapped up in a lot of hope and possibly a lot of difficulty in getting to in the first place. So it's like no one wants to feel that their loss is diminished in any way. So I wanted to recommend that there's a new book that came out. Let me just preface this by saying, I think one of the ways that's helpful to heal from a miscarriage is to read stories of other women who have been through it. It's very comforting to kind of, you know, to listen to what other people have to say and to kind of share in that, even though it's not like a, you know, a give and take when you're reading a story, but it's still very helpful. So Our Stories of Miscarriage, Healing with Words is a new book. It's a compilation of essays and stories by different women writers who had suffered losses. And so I'm recommending that. I read some excerpts, and I'm familiar with some of the writers, and I thought it looked like a great collection. I have it on my list of things to read, but I have not gotten around to it. Another book that's on my list to read that I'm going to give a plug to, even though I haven't read it yet, but it's so funny because it's called Mamarama. If you Googled Mamarama, you might come across this woman's book. I mean, I didn't make up the Mamarama name, so clearly somebody got to it and wrote a book where the title is Mamarama, Sex, Kids, and Rock and Roll, which sort of describes her life a little bit. And it's by Evelyn McDonnell. So, you know, that might be worth checking out. I'm going to give it a plug just because we share a moniker. Okay, I think that's all for today. Thank you for joining me. Please email me at, should I give my new email address? My new email address, because forget about the old Opera Mail one, is mamaramatv@gmail.com. Isn't that easier? Yeah, I liked it too. Website coming soon. Bye.